There was a big debate earlier this year about S-chip and funding health care for children. Please describe your position on S-chip. Dan.
Well, Senator Obama, I believe, was in favor of S-chip. Can't really say the same thing about McCain. Maybe he doesn't like children. Not quite sure about that one. But Senator Obama's plan, every single child in this country would be included under his health insurance plan. That's the end of the story with that. Senator Obama believes that, like I said, every American should be entitled to health insurance. That includes every employee, every man, woman, and child. And so Obama's definitely in favor of that.
You're right, Dan. We don't like giving children health care. What do you think we are? Of course we want children to have health care. Like I said earlier, we just have a different way of going about it. You're going to put the government in charge of hopefully my future children if I ever get a girl to marry me. And, you know, I don't want the government bureaucrats to decide where my child can go or what medication he can take. I'd much rather put that in the hands of people who know what they're doing. And that's really, I don't know if that's McCain's position, but that's mine. Now, we talk about, you know, health care, and like I said earlier, and I don't want to keep sounding like a politician, just keep repeating the same thing. But the problem is, if you look at these places that have implemented universal health care, it just doesn't work. If you look in Quebec in 2000, I think it was 2008, 70% of their dentists got off the national health plan because they weren't making any money, and now you have these people who basically don't even want to do their job. Now, you look it up, we could stay in the mouth if you like. There's basically women in the UK who pull their own teeth out using pliers because basically they couldn't get the National Health Service, they couldn't get a doctor because they didn't want to take them on. Now, I don't know, when I have a kid, he's going to go to the dentist, hopefully regularly. I'm going to try to make him brush his teeth, but I don't know if he's going to. But when he does go, I don't want to have to pull out his teeth. You know, I want health care that's, like I said, quality. Not just there, but quality. Under Obama's health care plan, you keep saying that everyone's going to be covered. He says the kids are going to be covered, which is great, but not everyone's going to be covered under his plan, and that's something that I feel like people aren't recognizing.
Dan, 30 seconds.
Well, Alex still here didn't figure out a reason why Senator McCain voted against CHIP, which is interesting, the child health care plan. He also, before he mentioned about some third-party organization where he got stats that saying Senator McCain's plan would have 2 million more people. Maybe he got the stats and things to do. I'm not quite sure about that one.
No, we haven't conducted a study yet.
Senator Obama's plan will not force anyone to have federally mandated insurance. They have the option of using their own insurance providers. So if they have better insurance than what the federal government is going to provide, they can use that. My opponent loves mentioning Canada. I don't really know why the Republican Party never did that strong advocate of Canada until now. But
because they're doing something wrong.
Well, Senator Obama's plan, it's going to basically change the direction of this country. My opponent really has never really explained how Senator McCain plans on incorporating the 45 million Americans who currently don't have health insurance into the current society.
Okay, thank you. The last question goes to Alex. Alex, there are in several states in America are having problem providing specialty services and health care to their citizens because of skyrocketing malpractice costs. What would a possible solution be to that so that everybody in all 50 states gets the best health care they can possibly get?
All right, I think where we can go with this question is something that was actually stressed in 2004 and something that President Bush promised, and as a Republican I was angry that he didn't follow through on, and this is tort reform. It's completely unfair that when a doctor follows the guidelines and follows what's supposed to happen, all the safety protocols, and something goes wrong, that the patient can sue and sue and sue until these doctors really can't afford to stay in practice anymore. And there's a reason why you're paying those high premiums. It's to basically pay lawyers. Now, unfortunately, under John McCain's plan, one of the policies, and considering John McCain is really a man of action, I truly believe he will work to pass tort reform. And also what he's going to do is he's going to bring transparency to healthcare costs. Make it public. Let you know why you're paying all this money to go see a doctor. It's not fair that everyone, you go to a doctor, like I just went to a chiropractor, and I got a bill surprisingly for $1,000. And I looked at it, and it was $800 just for an office visit. And I don't know why. And I want to know why. And under John McCain's plan, we will have transparency. And basically, that's where I want to go with that.
Dan, 90 seconds.
Well, I can tell you why your doctor charges $1,000 because he can. That's what you do when you have, an unregulated market. Doctors can charge whatever the heck they want because they know they can get away with it. Under the federal insurance provided under the universal health care, Obama would then, an administration would help set some kind of guidelines that would, make sure that these doctors didn't charge such high amounts. They also, in terms of tort reform, I think Senator Obama being, editor of his law review would definitely best be able to handle tort reform. I do agree with my opponent here, probably the one instance in that litigation in terms of malpractice has skyrocketed up.
30 seconds out, wrap up.
We agreed. I'm almost speechless. But basically, like you said, Obama's plan, you have to understand, too, we keep saying universal health care, but Obama contests that this is not universal health care what he's doing. He's going to allow people to keep their own private insurance. Now, this is great if it's still there. Now, if you look at what's going to happen is that the government is going to be able to artificially keep their premiums low and drive the private industry out of business. If you look at the numbers, under Obama's policy, 56 million people will no longer be insured under private insurance.
Thank you very much. Thanks to Alex and Dan for speaking